Okay. Well, thank you for everyone joining tonight, the transplant talk on mental well-being, and it's quite fitting that we're actually doing it in Mental Health Month. So I'm just going to run through the sort of format, I guess, of tonight. For those who have been on our other webinars, it's going to be run slightly different. So tonight it's going to be just a Q&A question. So I've received some questions via email and also through the registration system. If people want to get involved tonight, is down the bottom of your screen there's a Q&A button which you can push on, and you can type your question in there. So and we'll try and get to it. So we've got about 215 people on tonight, so we'll try and get through all the questions. A lot of questions came through around COVID vaccination, but unfortunately we're not going to be able to answer those tonight, as we don't really have anyone in the medical field that has the knowledge around that. We do have a webinar on the 3rd of November, which is an update on COVID vaccinations for transplant recipients and the waiting list, which is going to be presented by the heads of the transplant units across all organs, and providing data. So all those questions that have been submitted will be answered on the night. I do have them, so I will also try and get some answers before that and email those people directly. So as we get started, obviously my name is Maddie Hemstock, work for Transplant Australia, membership and sports administrator. I've been involved in the transplant community for over 30 years now, and also worked in it for the last 15 years. So obviously I have a background working in it, but also as a transplant recipient, and this is around mental well-being is obviously a close topic for me, and I deal with people all the time around it. So we've come up with about 6 or 7 that we're going to talk about, that I come across all the time talking to patients, and some of those I fit into as well. So but before we start, I'd like to introduce the panel, and I'll get them to just introduce themselves first, and then we'll start getting into the questions. So Cathy.
Hi Matty, thank you very much for the introduction, and good evening to everybody. Thank you so much for joining us tonight. My name's Cathy. I'm a social worker at the Princess Alexandra Hospital here in Brisbane, up in Queensland. So it's lovely particularly to have those from down south who we haven't been able to see in person for so long, and online tonight is great. As a social worker here, I'm covering Queensland Liver Transplant Service, and I've also worked in the kidney transplant service here for many years, and also in Victoria before I was living in Queensland. I was at the Prince Henry's Hospital and Monash Medical Centre for a 10-year period. So it's lovely to be here tonight. Thank you very much, Matty.
Thanks, Cathy.
Hand over.
Hi, Maddie, and hi, everyone joining us tonight. My name's Katherine. I'm a clinical psychologist here as well at the PA Hospital up in Queensland. I've been with our renal service primarily for the last 4 to 5 years. So working with people around the diagnosis up into, I guess, leading up to getting ready for transplant, during the transplant process, when they're discharged and when they're going home as well. But I also work with people years down the track after their transplant, particularly in the area around kind of their emotional health and their mental well-being. So lots of different things, very, I guess, important questions that we've got coming up tonight that I'm really excited to work with Cathy to help answer the best that we can tonight for you guys.
Thank you, Katherine and Cathy. So I guess the first one, dealing with survivor guilt. So this is obviously around waiting for your transplant, getting your transplants, and then you might have a friend who was on the waiting list and unfortunately didn't get a transplant, but also the donor side, someone obviously having to die for you to be able to live and get a chance. So is there any tools or advice on how to handle that?
What do you think, Katherine?
Yeah, so I think it's a really big topic in this area. In particular, I guess when people have a chronic disease or they're requiring a transplant, I guess the transplant is a gold standard treatment for that condition. So often people, I guess, longing for and just waiting for some time to be able to receive a transplant and hoping that they might be eligible for that transplant. And just there's a lot of mixed feelings and a lot of feelings in that process already. Sometimes I guess the challenge is it can be a little bit of a difficult one, because whilst we might be really longing for that new, I guess, next chance of life, that's often, I guess, met with that feeling of that somebody might have lost their life to be able to provide us that transplant. And that can come with a bit of, I guess, a difficulty in managing those different feelings. And I think it's really important for me, that first idea that life was not sacrificed for that organ transplant, rather that the donor had chosen to be able to preserve another's life in the context and the timing of their death. And I think that's a really important, I guess, point to be able to focus on. I think the other part too for me that comes to mind is that the organ donation plays no role in the death of the individual that might have been providing that organ for the next person. And the family, at the point in time that they're grieving the loss of their loved one, often find, I guess, a lot of comfort in the fact that that organ could be given to somebody to give them a new hope, a new version of their life as well. So they're, for me, the biggest points that come to mind. The other one that I think is really important that often comes up for me is that role of people feeling like they always have to get the most out of their gift. They always have to be happy, and they have to show people that they're making the most of their life. And sometimes with that, it's tricky, because as we know in life, we feel a whole range of emotions. We can't always feel happy. And it's okay to not have those times too, but while still appreciate that gift. So not feeling like you have to show somebody that you're always happy and always in a particular state, and that demonstrates your appreciation of that gift from somebody else as well.
Matty, I think another side to all of this, you made reference to the whole concept of survivor guilt, and I think what Katherine's been mainly talking about is that concept of receiving an organ from a deceased donor who has not made it, and you are obviously the fortunate recipient of that gift. The other side, I think, is the fact that so many of the patients have got long-term relationships with other patients in the unit and people with whom they know, and perhaps they dialyse with over several years, but then one of those patients actually doesn't survive to the point of getting a transplant, or someone else on the transplant waiting list who they know, either through the clinics or, as said, has gotten quite close to through their particular treatment processes. The person who actually does get a transplant can feel really awful that their colleague patient, if you like, missed out. And I think that's possibly another big part of surviving and being part of a whole process. Now, it's very interesting. Some years ago, I had a patient, she was only 11 years old, and she was actually a liver recipient, but another little girl who was a very similar age, they'd known each other since they were 5, that child didn't make it, and the 11-year-old to whom was referred to me was very upset. She was distressed, and one of the things that we actually did was we spent quite a few sessions, and it didn't actually need that many. I think it was only 2 sessions in the end. We decided, what can we do to best remember that person? How can we make the best? And also, as an 11-year-old, what might she like to do to live the best version of her life that she possibly could? So in a way, she was turning her sense of grief and guilt and sadness around in such a way that was really useful. And I think it's sometimes from children that we can actually learn really important lessons as adults. We sometimes forget it's the most simple things. It's knowing that there are some aspects of the entire process we cannot control. We cannot control what's going to happen sometimes to aspects of our own health, what day we might get called for a transplant, or how things will actually go. But what we can control are the very small things, and it's often the minute things that make the most difference. So perhaps that doesn't fully answer the question, but it's really about what can we all do to be the best version of ourselves in the circumstances, allow ourselves to grieve, to feel sad, to talk about it with others, to talk with staff. Sometimes units have actually set up a small support group for a couple of weeks so that people can share and get those feelings of sadness, because people often just like to talk. So that in itself can be the very first step, and that's what this 11-year-old did. She talked, she decided to make a special little gift box for her friend, and she gave names to all of her feelings, and we wrote them on bits of paper and we put them in the box, and we put special other things in there. And before you knew it, she had something that was symbolic of her friendship and her future, all mixed into one. So just one example, something quite small, but thought I'd share that.
I think that's a really great example, and I think that I really love that normalization of that feeling and that being able to express that to somebody else. Yeah,
absolutely. Yeah.
Excellent, thank you. I guess Katherine brought it up a little bit around feeling sad and stuff. So medication side effects, which is a very big one for a lot of transplant recipients, and prednisone, the great prednisone that can roy rage and anger and some to depression, depending, everyone's a little bit different. But what advice could you give us to sort of cope or be aware of those that's sort of happening?
Wow, this is one of the big ones, and I guess one of my hopes is that over time people might reduce the medications that are actually triggering or activating a problem. But I think you actually used a word, Matty, in your introduction question, and that was being aware. And sometimes just by being aware that, first of all, that this is even a thing, that it's a possibility, and that it can become a very real thing for many people, particularly in that early transplant time frame. But then, of course, I do talk to people years down the track, and they sometimes will say, I'm still feeling a bit enraged, or I have times when I don't know what comes over me, but I'm just not myself. So it's very real. It can be very real at any time. But I personally think that one of the things that's most useful is, first of all, just acknowledging that. And sometimes once you say, this is a thing, it's happening, what's triggering me, and to give yourself some space to think that through and talk it through. If you need to, just pick up the phone and talk to one of the professional staff or talk to a family and say, look, that feeling I'm getting, it's there at the moment. And once again, it's about, there might be aspects of it you can't really control, but then there's other things that you can do to really settle yourself down perhaps, or to just focus on something that matters most to you at that point in time, or to be a bit kind to yourself and say, you know what, it's okay to I'm going to have a doona day today. I'm not getting out of the house. I just want to sit tight. I'm going to watch those movies I want to watch. I'm going to do whatever works to get yourself through, because tomorrow's a fresh and a new day. And sometimes it's unpredictable. The next day you might be feeling 20% better, 30% better. So perhaps it's sometimes about just deciding what works best for you, being mindful of your triggers, and being kind to yourself, and not trying to fight the feeling, but work with it. Work with it. Yeah. What do you think, Katherine? Have you got some thoughts around that?
I think it's a really important one, because I think, as Cathy's mentioning, it's important to be aware of the changes in yourself and the symptoms that might come up, particularly in those early stages of transplant, when you are on a number of those really important medications, to be able to, I guess, support your transplant and minimise that sense of rejection. But then I also think it's something that, I think there's two processes that are at play. One, I guess, is the new medications and the changes to our cognitions and our emotional state while we're on those medications, particularly on different dosages as well. And that's going to be very different for different people. But I also think the other part that comes up is that it can be a really stressful and demanding time in our life. We're going through lots of changes, as Cathy mentioned before. We don't know when we're going to get that phone call, when we're going to get that transplant. We might have been on the list for some time. Before we get that call, we might have been just feeling really unwell and just really fatigued and exhausted. So you're going through all of these big life changes. You might have had to have family members step up to give you care and support. So naturally, during big life changes, we expect changes in our emotions as well. So we kind of get this interaction between medications and then big changes in our life, where we often feel, I guess, out of control. And as Cathy was mentioning, I think it's really important to be aware of that, but also to, if you're feeling a bit unsettled, if you're feeling irritable, anxious, kind of agitated, difficulty sleeping, all those little tiny things, I think it's really important to let your local treating team know, because there's lots of different ways that they can support you, whether that's connecting you in with somebody to be able to talk or learn about that further, whether that's having a little bit of a look at your medications and seeing how they can titrate it to be able to minimise some of those side effects.
That's a really good point, isn't it? Yep.
I think the really important thing is it's often can be a way that we can look at it to see if we can make it any benefit for you there too. But the other side of it is being kind to yourself. You may not have those high doses of medications forever. It may just be in those initial stages, or just things might have come up by which they're making changes. But thinking about what's in your control, coming back to your self-care, sleep where you're able to, eating kind of good quality foods, physical activity where you're able to, depending on what stage you're at as well. All little tiny things that you can do to help manage and regulate those emotions. I think the other thing too is just acknowledging that as human beings, like we said before, it's really common for our emotions to fluctuate. And we often get concerned, I guess, if they're having quite a significant impact on our quality of life, on our ability to work, or our engagement with our friends or our family. And if that's the case for anybody listening tonight, it can be, really helpful to check in with your treating team to see what options are available, or even your local GP will be able to provide you some really valuable support there too.
I think something that it just reminded me as Katherine was talking, Matty, and that is that one of the things that constantly strikes me is that even when people are experiencing a period of time when they're just not quite 100% right, or they're feeling a bit tipped off and a bit ultra angry or a bit ultra emotional, or whatever it might actually be, sometimes it's important just to stand back and to say, it hasn't always been this way. And so, of course, you might be able to relate it to the medication, but, perhaps it's all those other factors that are going on as well. But to also use that time to maybe talk to one of the professional staff about, well, when have things gone well? And when they did go well in the past, what did you most notice about yourself that you either did or you contributed to, or where were your own strengths in doing something really well? Because I think when people get so caught up in the feelings of what's going on, it's a busy time, it's coming into clinics, it can often be a time where you literally forget how good you were at managing hard things. And sometimes that reminder of, oh, I think, okay, I've got this. There have been other hard times in my life. It may not be to do with transplant or medication or prednisolone or whatever, but there's been hard stuff that I've done. And sometimes that little reminder can be the biggest help. It's almost like a small, it's a bit of an apparition. It's a eureka moment where you think, I can actually do this. Because at the end of the day, everyone's an expert in managing their own life and their own situation. And our job is to support you to do whatever is going to be best for you. And for one person, it might be a reminder that doing yoga was fantastic for them, or going for a bushwalk every Saturday morning, or just name anything, a coffee or whatever it might be. And that, I haven't done that for some time. I'm going to make myself get back and do something, put myself back in the driver's seat. And that, again, it comes down to that awareness and that control and just that thinking when everything can feel a bit awry. So I hope that helps just in thinking about some of those things. Yeah.
And I think just one final thing, sorry, Maddie, is I think Cathy just prompted me. As individuals, we know ourselves better than anybody else ever can. And I'm often saying to people, there's never a silly question. If there's something that is happening in your body, in your mind, in your emotional experience that concerns you, then it's always really important just to ask the question. And just having the team being able to give you some of that information back can be really, I guess, validating and understanding of your experience as well. Thanks, Maddie.
No, that's great. Thanks. I guess now this sort of moves in, and there's a couple of questions online that are going to fit this category. And it was an issue pre-COVID, but it's probably going to become more of an issue post-COVID when the borders open up and stuff. So it's dealing with social engagement and worrying about catching something. So obviously being immune suppressed before COVID, as I said, a lot of people were worried about going to certain environments and potentially catching something and being basically staying at home and not doing anything. And obviously with COVID and the borders all opening up over the next couple of months, this becomes an increase, I guess, scenario with potentially catching COVID and stuff. So what tools or advice trying to deal with socializing and avoiding risks and obviously still living a life, not locking yourself up?
Well, there's $1 million question. I'd love to
Yeah.
have all the answers to that one. But you know what is most interesting, that the message that's constantly coming through to me, and of course, remembering that I have got no medical training whatsoever, other than probably year 12 biology. So maybe take what I'm saying with a grain of salt. But what I'm hearing around the medical ridges is that the most important thing people can do is fortify themselves against COVID. And really the most important thing is to make sure that you're in that vaccination queue and you're getting yourself vaccinated. And I believe there's a booster shot that is being talked about within the transplant community. So whilst I won't specifically talk to all of that, because that's really outside my domain, but I think to make reference to the fact that people can still take quite a bit of control over their life. It's very important not to let this external monster to eat us. It's really important that we do everything we can. It's what we would a bushfire. We would say, all right, well, what type of house are we going to have that's going to minimise the risk? What type of distance from the trees will we put the house? Whatever it might be, it's about how do we risk minimise in order to make the best of each and every day of our life. So the very first thing is to check in with how you're viewing things and whether you've taken some practical measures to look after yourself. Now, of course, there may be some people who for medical reasons can't be vaccinated, or there's an issue around that. And that's something they would very specifically need to discuss with their doctors. And of course, once again, I'm not pretending to take over that conversation, but certainly it's about doing what you can logically do, take on board what is on offer, and run with that as best as you can. Because at the end of the day, this is your life. We all have one shot in life. And it's about doing what's going to work best for you. In conjunction with that, I guess it could also be not putting yourself in further risk situations like massive crowds, or, you know, just essentially following the advice of the governments of each of the states. They're very clear about what's workable, and then that filters down to the transplant teams, being able to give really clear information, but on an individual level as well as a group level. So very important to take all of that on board, but probably just to be thinking, well, what can I do rather than what cannot I do? And if it's okay to go for a walk in an area that you love going to, that, you know, but you may not go during peak hour when you're literally jostling with people, or do you wear a mask, or do you get a special type of mask that has even more fortification? That, I guess that's a possibility as well. So it's about deciding where is your level at risk in the whole thing, taking control and talking to your doctors, and really deciding for you what is absolutely workable. But my take on it is that there is an expectation that we will continue living in the community as what we always have. And transplant patients have always done that. People, I mean, I see transplant patients out and about all the time. I don't see them just hiding. And that's the great thing. Clearly, one has to be careful about some things, in particular the sun and a whole range of things, but hey, shouldn't we all? So I'm wondering if it's really just a case of thinking, focusing, what can I do, not what is not working, and what did I enjoy doing before, and what can I do again? So, and then using all the tools at your disposal. That could be online things, online friendships. It could be going to local interest groups, even meetup groups, whatever might be happening for people, enrolling at uni, enrolling in TAFE, doing the normal things, but just being a little bit careful without feeling that you have to be frightened. And if you are frightened, come and talk to someone about it.
Yeah, I think there's a lot of really, really important points in there. And I think the one additional practical strategy that I would add to that, I'm sure, I guess, we're very sick of doing things online and catching up with people, I guess, via Zoom and forms like that. So it might even be thinking about people that you would feel welcoming into your home, small groups that you feel comfortable expressing, maybe that you're concerned with, that I feel got suppressed kind of immune system. Can I check in to see how you're going at the moment? Have you been to any hotspots? And just having that conversation with people if you do have that high level of concern about that. Because as human beings, we're not designed to work in isolation of other people. We're designed to be connected to other people. And it's just about, I guess, in this new times is thinking about how can we feel connected and remain connected with other people in a way that we feel safe, but also not being too, I guess, cautious that by which we feel disconnected around that fear too.
Absolutely. Yeah.
Excellent. So that's from probably a recipient side. So I'm just going to ask from another point of view. So family members, so if the recipient is concerned about going out and it starts affecting the family dramatic, husband or a wife, but the recipient doesn't believe they have an issue, but it's obviously upsetting the partner or the family thing. How some advice for them to handle that, and would you recommend that making an appointment with either a psychiatrist or is a good way of going to try and nut it all out?
Can I just check I understood your question? Sorry, Maddie. You're talking about if the recipient's partner wants to go out and might not necessarily be respecting the needs of the recipient.
No, the partner wants to go out. The recipient is worried about catching germs and stuff, so has been a hermit. But it's up, so the family can't go out as a group, and obviously that's probably potentially causes some issues there. So it's more like from a partner side of a recipient, is there advice on to handle the situation the recipient's in, and try and techniques to talk to about so they understand both sides of the story.
Yeah, I think it's a really a good question, Maddie, and I think it's comes back to the form of communication and being able to express our needs and our concerns within our family and those really close intimate relationships that we hold. You mentioned the idea of seeking extra support, and I think that's a really good one. I'm naturally biased, being a psychologist. I think that it's
we're very biased.
We've got a biased panel tonight. But I think in times like that, if you have an attempt to chat to your partner and you feel like your needs aren't being heard, or you don't feel respected in that, then I think that could be an opportunity by which extra external support could be of great benefit. I often encourage people, if that feels like that could benefit you, would actually be to chat to your local GP or your local treating team first to see about what are some of your local options. We have a whole range of really wonderful family therapists in the community that are really approachable and really lovely and would be very well equipped to be able to support people in that domain. It certainly doesn't necessarily need, I don't think the input of a psychiatrist straight away, but just that idea of that seeking supports and strategies that they could use as tools to be able to help communicate their needs to each other at that time.
Excellent. Yeah, I would agree with that. I think that's very important. I think often people aren't sure where to start because people hear that there's counsellors, there's psychologists, there's social workers, family therapists is what Katherine made reference to. And this is where the GP can often be a good first port of call. But I think most people everyone who's a transplant recipient would have a home transplant unit to where they're connected. And all of those units do have either social workers or psychologists who are more than happy to take a phone call. And very often what I find is just even a one-off phone call can be enough to identify what might be a really good referral pathway for that person, where might be helpful for them to go to. And certainly through the general practitioners, they can refer people to, the better mental health care programs. But that's marginally different again. But certainly when people have got differences in their own values about what's important to them, someone values really going out and the other's valuing, being very cautious. It's that can actually be the core of the discussion when someone goes and talks, or a couple go and talk to a psychologist or talk to a therapist. And very often it's about really deciding what matters most to that couple and helping them and supporting them to talk through in a very structured way, but not in an uncomfortable way, but to be able to really identify what outcomes are they most looking for together as a couple. And it may be that through this entire conversation and almost process of elimination, people can arrive at outcomes and conclusions that they didn't even think were possible or didn't even occur to them. So it's really almost that element of surprise that can come from having some really good conversations. But as Katherine said, it all starts with communication. And we're more than happy to communicate and to chat. It's our core business. We probably do far too much of it sometimes. But we're very happy to connect and to talk and to move people into directions, because they are real issues. and not to be minimised. And at the end of the day, what matters is important for each person and each party. So, you know, we're there for everybody in that respect. It's most important.
Excellent, thank you. So this next question, I fully understand the question and live it daily, but so it's ongoing medical issues. So you've received your transplant, you think everything's going to be rosy, and this can be at, you know, early on, you're back in hospital, or it could be 5 years, 10 years down the track, and you keep going in hospital over the years. Now, eventually, that gets to you. And some people it's earlier in the journey, and some you can last 10 years being in hospital, you know, 4 times a year, but eventually it has an impact on you. So some sort of advice on how you can deal with ongoing medical issues from obviously there's a medical point of view, which be sorted from the medical team, but obviously from a mental health and getting you down, and obviously which can potentially lead to obviously depression and all those other things. Some tips or advice on how to handle those ongoing medical issues.
I think it's a really important question there, Maddie, because I think, as you expressed, I think it's an incredibly commonly experience that people express to us in our roles. As you mentioned, we might get our transplant, and then we might have different medical concerns pop up over time. But it's often, I guess, the longitudinal journey of that can be quite fatiguing. And sometimes it can catch people by surprise. They might feel like they're traveling really well, and it can feel something that they're usually well able to manage might come up, and then it feels like it kind of just catches them by surprise and undoes them. So I think it's really important to be, firstly, just aware of that, to be able to acknowledge just how you're feeling, to give it a label. If you've got some, I guess, good family supports or social supports, feeling comfortable to share how you're going with them, if you've got a relationship by which you can do that. I think it's really important to communicate that to your treating team, because, as we've mentioned, we're a bit of a broken record tonight, but there's, in a number of our units around Australia, we have supportive people that can sit in that space with you and can give you support. But I think, again, coming back to what's in your control, how can I maintain the best version of myself that I can? I might be in hospital, but how can I continue to be connected with my family, with my friends? How can I manage, I guess, my diet quality where I'm able to, pending restrictions? How can I continue my physical activity where I'm able to? So doing those things by which we know is going to have the most positive impact on your emotional health and well-being that's in your control at that time. But also acknowledging that it can be, there can be times when it can feel fatiguing, and you can feel that sense of, I guess, burnout of having to come in and out in hospital. It can be really tiring as well.
Absolutely true, all of that, no question, Catherine. I think, again, what you were hitting the nail on the head there was that whole concept of when everything's still feeling quite overwhelming, or control and choices are feeling as if they're taken away sometimes, and you're just feeling ratty and awful. It's actually okay to sometimes keep feeling awful and to keep having a bad day or a bad moment. So, in fact, almost allow yourself to be a bit indulgent, or to have a good cry, or to, well, you don't want to be hurting other people, but, you know, just hit the pillow, or just do whatever's going to actually get some of that feeling out of your system. But at the end of the day, it's also about that, what I was saying earlier, it's reminding oneself about how I've actually done hard things in the past, what's in me, because what strikes me again and again, and it totally has over the years I've done social work, is how much ability and capacity people have to just keep walking that mountain. And it doesn't matter how high, or you think you're just about there, and then, you know, some huge boulder comes and knocks you down, or you think, oh, there's another pathway, I'll go up that pathway, and then there's a whole big branch, and you think, oh, I can't get across the pathway either. So it's amazing. It's just that sense of almost human resilience and ability that I think we often forget how good we are at moving forward in solution building. And in having these conversations, it can be very empowering. Is not a word I use lightly or often, but it is a sense of empowerment to be able to think, I've got this. I can actually do this. I can do hard things, even though I'm feeling pretty revolting today. I didn't want to hear what I just heard from the doctor. It looks as if I'm going to be having to do some dialysis next week. I thought this transplant was meant to be working. What's going on here? Just as an example. And in trying to pull together those feelings, sometimes it's just remembering, how have I actually done hard things? What am I going to do? Might be different from the person in the next bed or the next clinic chair or wherever, but you're going to do something special for you. So it's that resourcefulness. And I think it's also just being a bit generous and kind to yourself and saying, you know what, I want to go down and I'm going to go and get that coffee. I'm going to do something really nice that I just love to do, says me, who is a bit of a coffee enjoyer. And I know you are too, Maddie. So there we are. That makes two. And probably you, Katherine, I'm guessing three. But, you know, sometimes it's just doing or getting something that's just really nice. It's going to get you through the day. And that's great. As long as there's no harm done and it's something that you enjoy and you're not completely defying your whole diet or your fluid intake. It's about just doing something that works. And sometimes it's even about finding something you've not thought of before that works. It may be that you make a decision to, and this is probably a bit far-fetched, you might think, you know what, I really want to get a puppy because it's something I've been thinking about and I've been alone at home and I'm sick of this illness. But I think something like that will be really nice for me. And so you research it, you look into it, and maybe last year they ran out of puppies at the RSPCA during COVID. I did hear that. But I'm using that as an example of doing something that works and that is sustainable and caring for yourself. And at the end of the day, that's what matters most.
And I think one thing to add on to that, I think that practicing that role of self-compassion, of being kind to ourselves, but as part of that too, making sure that we're setting ourselves nice, realistic goals at that time. If we're going through, I guess, an ongoing medical issue, we might have to reflect upon, what are we working towards at the moment? Am I setting myself with realistic expectations today? Can I actually achieve all of that at this current time while I'm in hospital?
Yeah, absolutely. So don't be hard on yourself. Sometimes just being able to get through that conversation with the doctor or get yourself to next week or to do whatever is actually a fabulous achievement. So break it down into very small parts, tiny parts if it needs to be. I've known patients who say, I just want to get through each hour today, and I'll talk about and say, how might you do that? Or how will you know that you've done that successfully? So a whole conversation emerges, and before you know it, they're through the day, and the next day they say, that made a really big difference to me.
Excellent.
So, yeah, and I should say, please, this is not to say all go and buy a puppy, or Cathy said to go get a dog, but I'm just using that as almost as an illustration of setting goals and thinking and process. So you've all got that ability to do that quite beautifully, I would suggest.
Excellent. So the other one, the other one I want to bring up is around relationships. So over the years, I've seen a lot of issues around relationships, and there's two parts to it. So there's the first part, you're being sick and you've met someone, and or you're married and you've got sick, and so you've been in I guess unable to do a lot of things due to being unwell. Your partner's gone into maybe a carer / medical support thing, and then the second part is you've needed a transplant post transplant. Post you're married, then you have a transplant, and a lot of people, when you get a transplant, obviously your outlook on life changes. You want to do things that you've probably never done before due to being sick, and sometimes you leave your partner behind because you want to start, might be traveling, or could be skydiving, could be anything. Like, you just want to make the most of life while you can, and your partner's not there with you. And I've unfortunately seen a lot where it ends up in divorce and etc. Yeah, some advice on how to manage relationships to try and bring either your partner along with it and to get them to understand, or how do you have that conversation, that things need to change, like,
I think possibly deciding to have the conversation in the first place is a very important one. I think you've hit some really, really vital and very sensitive and incredibly real issues. And I think real almost irrespective of whether one has a transplant or not. I mean, navigating relationships in life is a pretty tough gig, and it's one that we don't necessarily arrive with a handbook for. And often the relationships that we live in adult life has a little bit been influenced or affected by our belief systems as what they've been developed over the years, things that we've watched and seen and been exposed to. And in some situations, some people, they've done pretty well in that respect, and others very sadly have not. We're very aware that, you know, a lot of adults were abused as children, both men and women. We know that some of that has really shaped how they are as adults. And then you throw a transplant into the mix or chronic illness, it can be really decimating to try and identify and work out, where do I fit into this? What do I do? What do I want? But I think this is once again where really good communication can be useful, either between the couple or for the couple to come and talk to a professional person who can really identify once again with them, what is it that they're most wanting to achieve or to get back to. And years ago, I know when I worked at Relationships Australia, one of the things I would often talk with couples about was, regardless of what stage of their relationship, whether they had only met 3 weeks before or whether they'd been married for 35 years, you got all ends of the spectrum here. One of the things was very often to think about it almost like a small business. If people were running a business, they'd have a business plan, they would be very clear of their profit and loss statement each year. They'd be very onto what their products were, what the outcome was, what they could afford to get away with in the business, what they couldn't, what their end point was. So people think about it, and yet we often just stumble into, I don't mean quite literally, but, you know, humans are humans, and people connect and hook up and consult and get married or get divorced, whatever happens. But people at the end of the day often don't have much of a business plan. And it doesn't have to be a business plan per se, but it's that communication about what matters most. How do we want this to work? What's our end product going to look like? What's comfortable for the two of us? So when you get a transplant or an unexpected illness within a relationship, it's how are we going to navigate this? This isn't in the rule book. In fact, the relationship didn't have a rule book to start with, and this is a whole new chapter, and I'm really stuck. So what we can often do is to support people to find a way to rewrite the rules and to rewrite what works best for them. And that's often a key. And it may be that through the conversations, through the rewriting of the rules in their mind, they actually reach a decision where they say, well, this isn't for us. We're going to find a way to separate amicably, perhaps. Better that than separate mercilessly. So that's the sort of thing I would probably be thinking, that it does come down to communication and connection and a willingness to confront and to say, you know what, we just need to somehow get through this. Let's find a way, and let's go back to basics, and let's look at what brought us together and what matters most and how we want to develop that. Would you agree that that's the sort of...
Yeah, I would agree.
You've seen in your...
Yeah, I would agree. And I also think that when we're diagnosed with a serious illness or we're going through a transplant, that brings up a lot of really strong emotions within a relationship. So we're having to be really patient and kind and caring and show that listening ear to the other. And there's going to be lots of different experiences that we feel are outside of our control if our close others get going through that experience. But also for us, it can be difficult to articulate that to our other when we feel like they can't truly understand because they're not the one going through that experience too. And so in my background, I did my thesis in relationship therapy. And I guess it's those moments where I guess when we have high, I guess, emotional states and just that sense of vulnerability, that it can be, just really important to communicate clearly to each other how we're going, how they could support us on that journey, how they could support us in our new journey, that we'd like to go skydiving and do those things now that we're feeling well. And sometimes we can't always assume that the other person understands where we're at, but it can be really important for us to communicate kind of how we're going, where we're at and what we're ready for as well.
I think it's often about deciding exactly that. It's how you want this relationship to be at this point in time. And you might develop some new ways of doing things. For example, you might say, well, look, come what may, Friday nights or Saturday mornings are going to be our time for being together, and we're going to not be mixing with friends, or we're not going to do things that we might have done in the past. So it's about making a definite plan. It's
and
about...
we might not talk about my health on that day.
No, and that's going to be a non-health discussion day. Or it might be just a time to acknowledge that, you know what, it's actually okay to cry, or to say, this is really hard, or I do not like this, or in fact, I hate this. I didn't invite this into my life. This is a visitor I didn't want in the room. Thanks very much. But it's here. How can we best accommodate and re-establish the furniture to allow this visitor, this nasty health visitor, to be a part of our life? But how can we actually still have a flourishing home, or a flourishing work life, or a flourishing family life around and amidst all of this, but not to let it actually overwhelm us? So it's once again coming back almost to that human resilience and that spirit of getting on and doing things. And again, people are way better at that than they often give themselves credit for. They've just got to give themselves permission to tap into it. And we'll help you tap in as much as you wish.
Excellent. And just a bit of a side, I guess, for single people that have had transplants or any medical condition, chronic disease, and they want to meet someone and they potentially met someone, how and then obviously you've got to talk about the conversation of your challenges that you've got, and how would you bring that conversation in when you've just met someone, or you're early in your relationship, and you obviously just want to get them on page early before it becomes too hard. You're committed, and then you're going to hit them with them, and then potentially they could run.
Look, I think that's going to look probably different for everybody, unfortunately, Maddie. I think it's one of those things that where everyone's going to have a different level of openness and a different time by which they're going to feel ready and able to really express those true parts of themselves. And I think transplant, the idea of whether you require a transplant, whether you've had a transplant in the past, falls in that same category of all the other vulnerabilities that by which we'd like to share with somebody when we get to know them. So I think it really comes down to, do you feel safe with that person? Would you like to share that with them? But also not feeling like you need to share that either, if you're feeling kind of pressured to do that as well. So I think people are going to sit on a different level of kind of comfort with that.
Absolutely. And look, it can be difficult to navigate. I know that I've spoken to sometimes people who've had transplants, and they've said, look, I've just made a rule that I don't tell anyone until the second or the third date that I've actually got a transplant. And so it's completely life as per normal. I mean, whether it slips into conversation or the prospective partner happens to see them taking some medications with dinner or whatever it might be, it might lead to conversation. Whereas I've met others who say, look, it's part of the package right from the get up and go. And if someone can't accept me whole as bolus for what I am, well, that's just incredibly bad luck, and that person was not meant to be.
Yeah.
So whilst we don't want it to necessarily be one extreme or another, I think Catherine's right. It's very individual for each person. And maybe the important thing is for each individual person to have a chance to work out for themselves as to where their level of comfortability is. And what one person's level is, it might be quite different from someone else. They might really be good about holding on for quite some time before they disclose anything, and other times, as said, it's right from the very beginning, and love me or leave me. So it's a little bit about the individual self-perception, but it's also about honesty and openness and transparency. And at the end of the day, if that's what you most value, that will come through. So that's what the person is probably going to wish to be with you for as much as anything else, because they're not going to go with someone who has been really dishonest for 6 months or hasn't told them something. And then it's like, bingo, here's some news. And it's like, oh, okay, I didn't quite see that coming. So look, it's a tricky one. And I think it's also difficult is I've also seen situations where, couples have got together and perhaps one of the couple had a transplant as a child. Or as a teenager. They've met someone in their 20s, and that person, the other partner didn't know them as a child, was never there when they had the transplant, didn't see them go through this. And yet it may be that 10 years down the track, the person needs another transplant because by this stage they're in their 30s, just making up the ages here as we go, but this is an example. And then it's a very new experience for the partner because they've never seen the person really that sick. They've never seen them have a liver that doesn't work so well, or a heart that's starting to give in, or needing, really specialised treatment for a lung disease. So it can be very varied according to where people meet one another in the whole spectrum of activity, but very real situations. Generally speaking, I find that partners are very supportive, and by that stage they know that there's a possibility there could be a problem down the track, but that can often be very strengthening for relationships if it's actually supported in the right way. Conversely, I've also seen situations where partners find it impossible to handle and cope with, perhaps for a whole range of reasons, and that's not to be judging them in any shape or form. It is what it is. But I think our work is to say, how can we best support the two of you to make the very best decisions for the two of you? Not for anybody else, but for the two of you. And that's really what it comes down to. So once again, people often have way more resourcefulness in their mind than they give themselves credit for.
Yeah, would agree.
Yeah.
Excellent.
This is a topic we could talk about all night. I don't know if you've got any ideas on that one, Matty, but you know, from you mix with people in the community a lot, with in the transplant community, and you hear stories. But,
yeah, no, I know it's a very interesting topic, and a lot of people have different opinions on it and struggle in this area. So, and yeah, so I think that advice is quite good. So we've got about 10 minutes to go. So I'm just going to go through some of the questions that I received by email and then go online, which we've addressed some of them online. But post-transplant, coping with the weight gain. So I guess that impacts physically how you see yourself and what people see you've gone in. You might be a stick figure. You've come out, you've ballooned up through the medication, obviously, for those particular prednisone, that first, when you're high maintenance prednisone, and just how you can cope with that mentally. Yeah, some advice or tips on that.
Look, I think it's a really important area, Maddie, because I think the literature tells us that weight gain varies across, I guess, the transplant recipients. But I also think it's a really important one because it has a really big impact on kind of our self-esteem, how comfortable we feel within ourselves, how easily we're able to go out and return to our daily activities. And I think it's one thing that I guess we have this theme tonight of coming back to what's in our control, coming back to sometimes medications, our increased appetite, lots of different things can have an impact on kind of what we might consume and our weight gain there as well. But I think coming back to, what's in our control. I often work with people around what are some mindful eating strategies? How can we be aware of and feel comfortable eating again? How can we work to love our new body, whatever that might look like? How is our body able to facilitate us to do what we would like to do each and every day, going back to work? How can we support our family? Those types of things as well. How can we, if sometimes people would feel, I guess they lose their confidence in being able to trust their body, depending on how long they've been unwell before their transplant. Sometimes it can take them a little bit of time. They might feel quite deep and strength to be able to do things like physical activity after that too. So I think that's where I think linking into different support networks as well, your local kind of dietitian, your local exercise physiologist, to work with you to build that confidence, to accept yourself where you are, to meet you at that same level, but to support you, to give you some strategies by which might help you feel more confident in yourself, if that's what you would like to as well.
Absolutely. I think all of that's very important. And whilst I'm obviously not a dietitian or a sports physiologist, probably need to see both some days, but what I do find is that it's often the smallest of things that make the biggest of differences. And I very often do hear the dietitians, and I think we read this a lot just in the general media, and that is that it's most important that we don't do any crazy sort of binge dieting, that you talk through things with your dietitian. It's all about really healthy lifestyle, healthy eating. And again, this is once it's coming down to personal choice, that people have way more choice about things than they often think. It's so frequently I've heard people say, but, I went to the supermarket and there was all this really yummy food, and well, guess which aisle that one was in? It wasn't necessarily the fruit and veg. And understandable, we can all succumb to that to a degree, but it's about balance, and it's about saying, how do I have the best life I can? How do I still look after myself and have some fun times and eat a few things that I just absolutely love, even if I'm not meant to have too much of it? How do I do that in a way that's actually really manageable? And then also, how do I incorporate even just the smallest bits of exercise? And you might surprise yourself. It may be that you start on a new routine, or you start doing just a 5-minute walk each day and you say, that's all I'm doing for now. And then it might be 6 minutes the next week and 7 minutes the week after. So it's often the smallest of things that make the biggest of differences. And again, not being a dietitian or physio, it's not my area of expertise. It's more almost common sense. But again, it's coming back to that psychological power that we do have to make the choices. And that's where the support of the unit is so important, because often people just become so overwhelmed with what's going on, the germs of COVID, or the anxiety about what's the doctor going to tell me at the next clinic, what's my next blood test going to be like. There can be so many things that build up, but it's actually about saying, I don't know about all those things at this moment, but what I can do is something really proactive, and I can make myself eat the best things I can this week. I can actually really get the mix of that right, and I can do that 5-minute walk each morning that I wouldn't have otherwise done. Small things, but the things that make a difference.
Excellent. So another question we've got here, and this is going to be, it can be any organ, but this particular one's kidney. So guilt of passing a genetic kidney condition onto your children, which in turn has an impact on their decision to have children, hence coping with the lost opportunity of not having grandchildren.
I think this is a really important question. I think it comes back to this idea of grief and loss. As individuals, we can grieve lots of different things, and not often just the physical loss of somebody, but the loss of something that we had hoped to see in our life. And for me, the part that stands out of this question is that grief of that loss of the opportunity to have grandchildren in that relationship, but then also that feeling that of, I guess, the condition being passed down generations as well, and what that means of carrying that there too. So I often come into these questions of first with validation, that you didn't choose to have that condition. It wasn't in your control to pass that on down to your family members as well, and to approach yourself with self-compassion first from that respect there too. But then also sitting in that emotion and going, what does it feel like for me? What are those thoughts that come up with that? How can I engage with my loved one? And how can I connect with them in a really important way?
Absolutely. Look, it is a huge topic, and I think you're absolutely right, Catherine. It does raise so many issues for people. And I don't think there's a quick fix, and there's nothing I can say here that's going to make it better, because there is that feeling of grief, of having lost a hope, lost something that might be important. But then I wonder whether the flip side of that is that it's an opportunity to have some really open conversations with the family about other things in family life that might matter. And it may be that no biological grandchildren or great-grandchildren are going to arrive into that situation, for example. But it could be that there's going to be a range of other activities and values, and I'm not suggesting replacement of children, but I'm talking about the breadth of life itself, and that human life is very fragile, as we well know, and often the best laid plans are laid asunder. So we know that anything goes, and we know that, you know, basically things will happen while we're making other plans. So there's no certainties about anything. Or it could be that someone had planned to have grandchildren but then couldn't, and disease or no disease. So there's so many variations in the human condition that the really important thing is that people, if they do have feelings that are very impacting upon them, talk about it, go and get some counselling, acknowledge this is very real, your feelings are to be validated. It's incredibly important, and often that's the first stage of being able to reconcile, or to at least live comfortably, or a bit more comfortably, with the disappointment, even the anger. You know, why this disease, why is our family afflicted with this? This is just rubbish. It shouldn't be happening. And there's a whole lot of things in life that shouldn't be happening in general in the world. Or we could name a million things right now, but that'd be another whole 10 webinars. But it's about how do we actually acknowledge that sadness, but also look at and say, okay, that may not happen, but other things will be happening. And once again, it's digging deep, and it's getting into that individual resourcefulness and supporting people to be the very best they can be. And if there's anything we can do to support people with that process, by all means, get in touch with the health professionals in the units.
Excellent. I've got time for one more question, and those who have put questions through the Q&A, I will get them answered and email you personally if we haven't covered them tonight. But this one's around emotions again, so anger, depression. So it's obviously acknowledging common side effects of our immune medication, or is it a result of extreme trauma a transplant has been, recipient has been through, or is it a combination of both? So I guess, on the waiting list and the challenges and ups and downs, you've gone through all that, and then obviously post-transplant, that potentially could drum up some anger or depression at some point, or and obviously we've talked about the medication obviously has potentially some impact on that as well. So I would say it's both, but how to dealing with the trauma you've been through and before you got your transplant and potentially post-transplant, some tips on dealing with that.
Yeah, look, I think for our final question, I think it's probably one of our biggest. We've had a lot of really big questions tonight that I think deserve almost their whole webinar in themselves. Look, I think it really varies per individual. I think everybody has their own experience when it comes to transplant, but also thinking about and respecting people's backgrounds, what they've gone through previously, their previous kind of emotional health and well-being, the role of medications, the role of the significant life changes. There's lots of different things that can happen for individuals. So without, I guess, being able to meet and understand that individual, it's a little bit tricky to answer. But I think it is something that, if we just talk more generally in nature, I think as human beings, we experience lots of different emotions each and every day. Some of them are pleasant, some of them are unpleasant. Sometimes we find ourselves in situations by which we feel unpleasant emotions secondary to big life experiences or exposure to traumatic events, or just things that feel that big sense of outside of our control. And I often say to people, if they're fluctuating, if they're there for a brief period of time, that's okay. Give them a label, give them a title, give yourself some self-compassion, give yourself a day off, some time to yourself to be able to make sense of that. If you're finding yourself in a position where though you're feeling that each and every day and it feels overwhelming and it's limiting your ability to leave the house, to connect with your family, connect with your treating team, I think that's a place by which it would be really important to connect with your team to get some extra support, because often it is very manageable and is very treatable for people, and there's a lot of support available for you there too. A lot of people do go through those experiences without support, and that can be really challenging and tricky. And I guess we're here tonight because we want to really validate and acknowledge the role of our emotional health and well-being, I guess, on this journey, and really want to kind of express that there is a lot of support out there for people.
Yeah,
too.
I think you're absolutely right with all of that, Katherine. I'm quite certain it's that often when people are just feeling really overwhelmed and they've had a really rugged pre-transplant time frame, perhaps things weren't going so well for them, either while they were waiting for the transplant in the immediate time frame, or perhaps even in the years building up to it, because some of these things vary in their time frames. And then you have a transplant and you think, great, this is going to, you're nervously anticipating it, you're sort of hoping for the best, but you may be a bit anticipating the worst and you don't quite know. But to be able to then find a way to somehow get through all of that, and then it's really disappointing because it may not go to plan, or it could be that even 2 months later the doctors might say, well, look, we're really sorry, but this is just not what we thought it was going to be. Or it might be 2 months, it could be 6 months, but just pick your time frame. It could be anything. It's no more or less disappointing whenever things happen. But I think being able to give yourself that chance to express your feelings and your emotions, find someone with whom you're comfortable to talk to, be it someone informally in your social network, or sometimes come and talk to a professional who will just be able to guide you with some conversation, and just getting that disappointment out, grieving it, feeling that anger, feeling that there's something, but again, thinking, well, what have I done in the past when I have felt this way? Because the other thing too is it can tap into things that have happened way back when, that's nothing specifically to do with the transplant. This is just the last straw. So we really appreciate that people arrive with however old they are, that many years of life, and every minute of their life has been an experience of some sort, good, bad, or indifferent. So our role is to support people to say, for all of that, how have you gotten here and what can we best do to support? And sometimes people say to me, it's such a relief, I've never spoken to anyone about this stuff. I thought I was going crazy. And I thought if I spoke about it, you know, I would start crying and then I'd be uncontrollable and I'd never stop. And it may be for that whole 1 hour they don't stop, or 3 hours or 10 hours. That's okay, because every emotion will be moved through at some point. So we're there for the support, and I can't emphasize enough, pick up the phone and just make an appointment to talk to someone in the unit. Never be thinking, is my problem too small, or gee, my transplant was 6 years ago, I should be over it by now. If something's not right for you, really important to know that there is that help and support available right across Australia and New Zealand. If there's people chiming in from New Zealand, I'm not sure. But, you know, it really is important to use us as in ways which are going to be most useful to you in that respect.
100%.
Yeah, absolutely.
Thank you. Yes, thank you, Katherine and Cathy, for joining me tonight. And we obviously tried to hit some topics, hard-hitting topics, and hopefully we've been able to provide some tools or information to help cope with some of those that people are online. I just also like to say that Transplant Australia, we also have a staff member who, Judy Edwards, who is actually now a qualified social worker. So there's another point of call if you're having trouble through your transplant unit to get somewhere, that you can call our 1-800 line and speak to someone who's obviously trained in that area as well. And then obviously there's myself. I take a lot of calls, and even though I don't have any degrees and anything, I've got, I guess, living experience and can give some input. And
that's very valuable, Matty. That's certainly, I think, one of the most valuable things. And I was